This. This really astonished us yesterday when we came out with this story. Cancer researchers are claiming, quote, extraordinary results from a brand new cancer treatment. Fox News Medical A-Team's Dr. Manny is here. Doctor, we said, and so did other people, that this is a real breakthrough.
It is a real breakthrough. I mean, and this is research that's been going on now for many years. This is using your own cells, your own T cells. Imagine T cells being policemen. And now what we have done with these policemen, we have shown them a picture of the villain and say, go get him.
Really?
And very specifically,
that's how it works?
Very simple.
You take the T cells
out of my body. So you take the T cells out and re-engineer them and create receptors that are cancer receptors, and when they're put back in your body and they go directly to those cancer cells and kill them. So when you look at a small sample, and this is a small sample, 80, 90 people or so, very sick people that had gone through chemotherapy and radiation and you name it, and we're very sick. Right now we have 80% to 90% remission, which is very good. So,
that's fantastic.
Very good. So the first question is, does this cure cancer? The answer is no. It doesn't cure cancer yet. But
it fights it and beats it.
Right. And it's going to be part, I think, in the future of, getting more specific to cancer treatments, where sometimes you have to do, let's say, radiation or chemo, but you also add this immunotherapy so that you have a very good 90% remission rate, and this is exactly what you want, and hopefully those patients will not get the cancer back.
It's genetic engineering, isn't it? Because you take the cell out of my body, re-engineer it, rework it, stick it back in, and it becomes the cop on the block.
Listen, God gave you all the tools to heal yourself. We're just discovering them now.
Are you a Christian Scientist?
No, but God gave you the tools. We have this is T cells. God gave them to you. Now we got the message.
Oh, well said, Doctor. Well said. I got one more for you.
Yeah.
In response to the Zika outbreak, the FDA is issuing new guidelines for blood donations. Tell us more, please.
Good. They're about 3 weeks late. Every other country has gone forward to it. Again, they're preventing people from donating blood who have come recently from those areas where Zika outbreaks are being seen. And this is a prophylactic measure to make sure that they don't donate blood and that blood ends up in another patient that can get contaminated. So it's a prevention method. Thank God they did it. Other countries have done it.
Okay.
Europeans first.
Europeans first?
Yes.
That's a first.
That's a first.
Dr. Manny, all good stuff, and thanks for joining us.
Thank you, sir.
Appreciate it.